So if somebody goes to your office and they fit into one of the two categories of people, either really bad teeth, full mouth of extractions, or they're already wearing a denture.
Right.
What are their options when it comes to dental implants in your office?
We can do an overdenture. You put 2 implants here or 2 implants up here, and you can snap in, snap out. So it comes in and out.
All right.
Okay, downside, it's still a denture. You're still going to get stuff underneath it. You're still going to have to make sure you take it out in public. You have to excuse yourself, go to the restroom, clean it up, snap it back in. Much better. It's very popular for people, kind of breaking into the business and that type of thing to offer, things like this because it's simpler. Other dentists
do snap in, snap out. I'm picking up on the fact you're not a big fan of the snap in, snap out denture.
I'm really not that big of a fan. I do them to help people out because it is better than just a denture.
More affordable.
It's more affordable. Okay. It's more affordable option, and a lot of times we can step them into a permanent, fixed type of solution down the road.
Okay.
Now you can add 2 more. You can add more implants. Same thing. It's still, snap it in, snap it out. Still have a denture, and when you look at yourself in the mirror, you still have a denture. So what everyone wants is teeth that don't come out. So it's just like their natural teeth. So basically, they can eat and chew, and they don't have to think about, can I eat and chew this or anything like that. They can eat and chew normally, just like they had their natural teeth.
And this happens. I mean, on the day of the procedure, the process, they get an original appointment. If everything goes well, you could actually give them a set of teeth on the second appointment.
Absolutely.
Is that right?
Absolutely. Yeah, you come in, especially with all the digital planning we do today. We can literally plan, we do the initial workup, which is not painful. It's very simple. And we can use a digital scanner or, however we need to do that. Make all our measurements, get the pictures, send it in. The next time I see them for the surgery, we take out the teeth or put the implants in, whatever the case is, and we deliver permanent teeth in that same day.
Okay. Now, I've had guys on the show that say, Randy, the way we do it is we remove the teeth, we give them a denture to wear for 6 months. Then we give them their fixed teeth to go in their mouth. Is that still happening today? And what are your thoughts about that way of doing it?
I've done it that way in the past. It is happening all the time all over the country. There's a lot of people that still do it that old-fashioned way. It used to be, we're going to give you a denture, you're going to wear that, and you're going to have to suffer through that.
So they put the implants in and then put a denture on top.
Rich denture.
For the implants to heal.
Exactly. The implants have to heal. But there's really no need with today's technology to have to do it that way because that was a much more aggressive surgery. You had to, you're going in, you're doing it all freehand. You're, basically putting them in a denture, which they're going to hate. They're going to be miserable for 6 months while they're letting it heal. And then you come back in, and now you got a number of steps later on to deliver them permanent teeth. So it could be 7, 8, 9 months before they get the teeth. Well, we've eliminated all that. So basically, you come in for your examination appointment, and we do a workup, usually with about 4 weeks, maybe 6 weeks later. We schedule our surgery appointment, and done. And they come in, they walk out with permanent teeth.
And they're happy. You say it changes their lives.
It changes their lives tremendously. It changes the way they think about themselves, really. I mean, they really do have a whole new lease on life because they think of themselves differently. And they also can start eating and chewing and enjoying life and smiling. And for a lot of people, they've not had confidence, or they've not had compliments recently on their smile, ever.
So that's new to them.
That's totally new to them.
And now you get hugs, you say. Some people are compelled to hug you.
Yeah, that's probably the best part is the reaction I get at the end. People, a lot of people will, tear up, or some people will just, cry. Other people, I get a lot of hugs, and that's always good. And a lot of thank yous. And really, several of the patients, many of the patients that come in to my office, my own private office, and say, thank you. I really, didn't get a chance to say thank you. And I'm saying, look, the pleasure was all mine. I'm really happy that we could, help you, get to where you are now and enjoy life and not have to worry about everything.